Janet grew up in the Bronx and then moved to Brooklyn when she was a kid. Janet spent 12 years with the USA Olympics and the first athlete. Then she was an assistant goalie coach. Then she was a manager and an official. And then she was a doctor and manager of the team. So 12 years. She went to 4 different Olympics, always in a different role. She was already a chiropractor. She set up practice in Manhattan. We used to call her the chiropractor to the stars because she had a lot of the Broadway stars as patients. I actually met Janet in 2009, and she had decided to add network marketing to her chiropractic business. She's so knowledgeable. She has a way of presenting things so that a layman can understand what she's talking about. Just my privilege to introduce to all of you Dr. Janet Shefts.
Thank you, Carrie, for that introduction. The technology that we have now is called vibro-tactile technology, and it's a wearable technology. Now, you don't have to remember vibro-tactile technology. You just have to remember kind of what it does. And I'll tell you that the idea is not new that something on the skin can help stimulate your nervous system. It's a very old idea. And I don't know if any of you have ever heard of the TENS machines. When you're in pain, they'll sometimes put a TENS machine on you. And that's a form of what they call superficial tactile neurostimulation. Again, nothing you need to know. And now I'm going to stop with showing off with the big words, and I'm going to try to explain it in plain Bronx English, okay? Like Carrie said, I'm from the Bronx, and that's the way I like to break everything down. The patches are a brand new therapy, in my opinion, and this is all my opinion at this point. I believe that we're going to see a lot more of this kind of therapy and treatment, or I don't want to call it treatment because we're not treating diseases. We're just trying to help. It's a tool. Let's call it a tool to help give everybody back their best life, okay? So that they can live their best life, whether it's helping them with pain or with balance or with lack of sleep or many other things. The way I like to explain it is it's kind of like it's a little patch, and it's got a pattern on it. And it's got a pattern that you can feel, tactile. You can feel it with your hands. You can feel it on your skin. You put each little patch has a very specific pattern, okay? And it has been found that when you put a patch on the skin, the nervous system, all the nerves that are in that skin, if you can touch and feel your skin, you know there's nerves there, right? If you scratch yourself, you can feel that everywhere. There are nerve endings. I challenge you to find anywhere on your body, unless you had an injury or scars, that you can't feel a stimulus, okay? So that's how many we have, those nerve endings all over our bodies. Now what happens is when we put that patch on, it stimulates the nerve endings and it sends a signal up to the brain, actually to the brain stem, which is in the back of your neck right here. And in the brain stem, that signal gets sorted out before it actually gets up into the big brain. Okay, this is, again, you don't need to know this part, but I kind of think it's good to understand it. You don't have to say this to anybody else. But when you put that patch on, you're stimulating the nerve endings in the skin that get transmitted up into the brain and helps the brain to untangle or get the signal. Okay, so many people are saying we have one particular patch called the Liberty patch, and it's the very first one that I feel like everyone should wear every day. And the Liberty patch is like the base, okay? That's the one that opens up all the channels. We have tens and tens of thousands of nerve endings and nerves going through our body every which way. Think of fiber optics. But another way to explain it is, if any of you have ever used a computer and it got stuck, right? And if it wasn't a Mac, if it was a PC, the only way you could unstick it is by hitting 3 keys, Control, Alt, Delete. When you hit those 3 keys, what you're doing is you're rebooting the system. It's all those wires and conduits in that computer they've gone a little bit haywire, right? So by hitting Control Alt Delete, you're stopping the transmission through those areas and you're letting the whole thing, what we call reboot. If you think of it, the Liberty patch is the one that reboots our system. Okay? It clears all the channels, it clears all the tangledness that happens in all those wires that are throughout our body. Nerves, I doubt any of you have actually seen what a real nerve looks like. In my training I have. And the biggest nerve, the widest one, is about that wide. And that's like a fiber optic cable, because within there it has a whole bunch of little stringy nerves that go everywhere. That would be your sciatic nerve, and that goes down your body. So if you have low back pain and you put a Liberty patch on, it's what it's going to do is it's going to untangle and unencumber the nervous system and allow the signals to go back up to your neck, okay, to the base, to the brainstem. And that's where it gets all sorted out, goes to the brain, and then it tells the body to reboot itself, okay? So basically we have the Liberty patch, which is the rebooting process. And then we have the other patches like the Freedom patch or the Defend patch. So once you reboot and there's clear channels, then you put those other patches on. They have different patterns, and you stick that patch on the skin. That pattern then talks to the nerves and goes right up to the receptors for what it's supposed to go to, whether it's a pain receptor in the brain, or if it's a skin receptor, or if it's an illness, or if it's some kind of inflammation. And basically every ailment that we have, every pain we have, is based on inflammation. Whether you know it or not, there's something called silent inflammation that's accumulating within our bodies. And if we can't wrangle that, our health will diminish, our potential for health will diminish. So we want to get rid of all that inflammation. So you put the Liberty patch on first, and then whatever other patch you want to address. And we have 11 other patches. I'm wearing a focus patch right now because I was nervous about this, and I haven't been able to focus very well. It's like the iOS system in your Mac computer, okay? That's what the patches are. They're like the applications, okay? The first one is the Liberty. Always use the Liberty every day, and then whatever else you need to augment. When somebody says they have a pain, I'll say, what, I'm a doctor, so it's a little easier for me to ask. I said, do you mind telling me, what's wrong? What's going on? They'll tell me they have some low back pain, or they have shoulder pain or neck pain or something. I said, I have something that might help that. And they're like, oh, really? And then some people will say, well, I can't take anything more. I'm on medications for this, that, and the other thing, and my doctor won't let me. I said, well, you don't have to worry about that with what I have. They're like, what are you talking about? And I'll say, well, I have something that has no chemicals, no medications, no supplementation, nothing. And they said, well, what kind of side effects? Absolutely no side effects. Absolutely none whatsoever. And they look at me like I have 3 heads. And they're like, well, what is this magic thing? And then I'll tell them it's this new technology. It's something that in the next, I think, 5 years is going to be a household word. And because of what this is, everybody's going to know it. And it's going to change the way we treat some of the aches and pains and difficulties that we have. So they're like, okay, what is it? So I'll say here, and I'll show them a patch on my arm or on my leg. And then they'll say, well, what is that? Then you show them the patch and you say, you see this, you feel this pattern, and you can really feel the pattern on the outside. Okay. So just have them feel the pattern. And they're like, it looks like a thumbprint. I said, yeah, it does, doesn't it? Well, look at the pattern on this one. This one looks different because it's for a different root. Okay. So then I'll say, would you like to try it? And then they're always going to say yes. Almost always, unless they're, negative Nellies. And invariably, they feel a difference. And that's where I start. And that's how I explain it. You know what? I doubt there's anybody out there that doesn't have some kind of silent inflammation going on in their bodies. We all have it. Now, we don't generally know it. There's a medical test that they do to look for inflammation, and it's an indicator of potential heart disease. Now, you might not know that you have any kind of heart disease, but until they get this indicator of inflammation, then they can tell you that you have that, and then they can start looking further. The other thing is any kind of, now I don't like to use diagnoses. So any kind of a dis-ease in the body always has inflammation accumulated with it. When the body goes a little haywire and starts getting sick or has bad cells in there, it releases chemicals, and then that releases more chemicals, and those chemicals cause inflammation. And because there's so many organs, blood vessels, ligaments, tendons underneath our skin, there's not a whole lot of room for extra fluid. Okay, and fluid will go anywhere. And that's what inflammation is. So if we can get rid of the fluid, we will also be better off for it. So my number 2 rule in this company is everybody wears a Liberty. That's number 1. My number 2 rule is everybody wears a Defend with the Liberty, because the Liberty, remember, opens up the channels and clears the channels. And then the Defend can do its work better than without the Liberty.
I understand the Victory Patch allows for quicker muscle recovery. Should the Liberty and Victory Patch be worn together all the time?
What's my number 1 rule? Liberty. And then you add to the Liberty. All right. That's my number 1 rule. So the answer to that is yes. Liberty opens up the channels. Victory also brings oxygen into the area. It helps to increase performance up to 17% in certain areas and up to 38% in other areas. And especially for athletes. And that's what the Victory would be for. Somebody doing some very heavy work that competes, number 1, is an athlete. I don't care what age athlete. It doesn't have to be a professional athlete or an Olympic athlete. It can be anybody that's going out there and working out, going to the gym. I think it's really important. You'll be able to get a cleaner, better workout. You'll be able to get bigger and better and stronger. And you'll be able to recover more quickly when you use the 2 together. Okay, if you're just using the Victory, and if you don't have those open channels,
Right.
The Victory is not going to be able to do what it's supposed to do. Now, I'll give you just a little story. I don't know if any of you know weightlifters or bodybuilders. I happen to know a bunch. And I used to work out late at night, and that's when they would work out, and they'd be these giant guys with giant muscles and everything. And then when they would be leaving after their workouts, they would say to each other, they'd say good night, and then the last thing they say to each other is, okay, go home, sleep, and grow. And what they mean by that is that when you're working out and lifting heavy weights or doing heavy competition or heavy practices or anything like that, and you feel achy or sore the next day, what you've done is you've actually caused micro tears in your muscles. So when you get a micro tear in the muscle, guess what happens? You're tearing the muscle a little bit, and then what accumulates in that little tear? Inflammation. So you've got inflammation, you don't even see it. Okay, but it's in there and you have to get it out. And once you get that inflammation out, the muscle can repair. And when it repairs, it develops new and bigger muscles. Okay, so when these bodybuilders go, they understand that they go home and they have to rest, you have to sleep in order for your body to grow in a good way, not, after eating a cheese pie or something like that. Anyway, so sleep is important, and it's an important factor in the recovery system. But you put that Victory together with the Liberty, and then you'll see the advantages very, very quickly. And recovery time is much shorter. And that, when you get up to the college ball and the Olympics and pro and semi-pro, that's what you need to do to have the edge. You want to give your body a chance to be the best it can be, to perform at its maximum.
bone on bone is different than arthritis, right? You're right
Oh,
down.
no. Arthritis. What the word arthritis? The word arthra
Joint.
means
Joint.
joint. Itis means inflammation. What is arthritis? Arthritis is inflammation of the joint. Okay. You can have arthritis just from having, swelling. You can have it from autoimmune disease like rheumatoid arthritis or psoriatic arthritis. But what happens is it accumulates, not only accumulates fluids and inflammation in there, arthritis also causes sometimes the bones to put down extra bony areas, and it becomes craggy and stuff, and then it starts going bone on bone, and it starts rubbing and stuff. So that'll cause discomfort and the inflammation. I can't say that it's going to cure anything, because it doesn't. We're not here to cure anything. We're here to help decrease the symptoms, to allow you to live your best life at your maximum potential for health.
Yep.
Okay.
Yep. Yeah.
So the answer is I would try it. And that's my third, my triad, right?
Right. Right.
Liberty, then we have defend, and especially defend these days because it helps your immune system, but it also opens up the areas and gets more oxygen and good healthy cells in the bloodstream. And also it helps with, gut health. That's the immune system. Your gut is your where your health comes from, actually. So you want to keep that going, and you want to keep it as potentially strong as you can. And the only way you can do that, or one way you can do that, is by using liberty and defend. And then if you have pain or arthritis, as people call it,
I know.
you add the freedom. And again, this right now is me personally. When I talk to people, I tell them I have the 3 rules, and I call it the triad of health. There's all different things with triad of health, and that just happens to be in my lexicon. So you don't need the third, the freedom, if you're not experiencing the pain or the discomfort. However, the freedom may also allow you to get a better range of motion than if you're not wearing it. There are two kinds of people. There are the people that can say, I'm going to sleep. They go into their bed, they put their head down, and 5 minutes later, less than 5 minutes later, they're sleeping. I hate those people. I am so jealous of those people. And then there's other people who get in bed and they can't stop their brain. You can't blank everything out. You're thinking of too many things. It takes you a half hour, 45 minutes, whatever, to fall asleep. And that's extremely frustrating. So doing the defend and the peace, to me, sounds like a good way to start, because if you can use the defend to help get rid of any kind of inflammation, I'm big into inflammation, but if you can get the defend to take care of any of that, and the peace to calm you down and to slow down your brain and give you a moment to take a deep breath, and then you use the REM. You want to get to sleep as quickly as you can so that the REM can kick in, and you want to get as much sleep as you can.
Right.
So if you fall asleep in 5 minutes, you get a longer sleep if you wake up at 8 o'clock or whatever. But if it takes you 2 hours to fall asleep and then you still wake up at 8, you're only getting 6 hours, and only part of that is the REM. So if that works to slow people's minds down and calm them down enough to get to sleep sooner, it makes sense to me.
Why do different people experience different results with the patches?
Well, as a chiropractor, when we were just learning, we had principles of chiropractic, and principle number 6 is it takes time. And this is just makes sense when you're talking about the body and healing process. Every single one of us have different things going on. We all have our own personal maximum potential for health, even when our channels are clear, right? And we all have our own personal whatevers that we've endured throughout our lives. Some people heal more quickly than others. And if you have a problem like arthritis or something, it took time for your body to get like that. It took a long time, unless you had a trauma or an accident. It took a long time for everything to wear down. So now we're giving it a tool. We're giving the body a tool or a few tools to help it regain as much of its potential as possible. And when we give the body that tool, your body's going to react differently than my body. And my niece's body is going to react differently than my body. And we all have our own potential. So it takes time to get into that position where you've got the symptoms, whatever they may be. And now it's going to take a little time to clear them. Okay. So it's just because we're all different. We all live in different places. We all eat differently. Some of us exercise, some of us don't. There's all different circumstances. So in my practice, I always said, whether it was a product that I had that I felt would help people, or just, working with people, I asked them to give it 3 months. Now I know Jay has said, I've heard him say 21 days, and I've heard him say up to a couple months. So, it just depends on the individual. And with the patches, there's no harm, no foul, right?
Right.
You're not going to hurt yourself. Anybody can use it. I mean, there's no side effects. It's electrical free, so it's not an electrical type thing that you have to worry about if you have a pacemaker or something like that. Like I said, it's drug free, it's chemical free, it's supplement free, it's non-invasive, it's side effect free, it's age safe, it's pregnancy safe, and it's affordable. So why not give your body a chance to react
Right.
the way that you want it to, or the way you're hoping it will? And in 3 months, if it doesn't work, then I'll say, oh, all right, I can understand you being impatient, but I would keep going.
How would you promote this amazing system when speaking with the chiropractors and doctors so that they could use them in their office?
When I talk to my friends who are medical professionals, I basically tell them, hey, look, I have this new technology. I actually had a nurse here the other day, and she was checking on some people here in the house, and she's a registered nurse, very, very smart, does a lot of research. She was here and she saw a patch on my mom's arm. Actually, we had it on her forehead because she had a headache, and she asked me for a patch, and I went in and I put it on her shoulder, and she said, no, put it here. So she came out of the bedroom and she had this patch on her head, and she said, what is that? And Mom said, it's a patch. so of course, the nurse was curious, and she said, what is that for? And I explained, no medicine, no electrical, all the stuff that I just said, no side effects, this, that, and the other thing. And I said that Mom asked for it because she had a headache. Now, she's known my mom for 8 years now. So she knows that she wouldn't just say that, because I happen to represent, be a representative or a distributor. So she asked me. So that's what I kind of would do. I would go in, I'd make sure I'd have a patch or two showing, so that, when I'm talking to them at one point or another, they're going to ask, but remember, I also generally have an in with medical people because I speak their language. But I just go into it. I said, this is the new thing. You're going to see this, remember. And what I say to them is, remember when CBD just first came out and everybody was jumping on that bandwagon, and all the doctors started getting CBD and selling it in their office? Well, I said, this is beyond CBD, and you're going to see it, and you're going to want it in your office. You're going to want it, number one, because it will help your patients. And I'm hoping that you're in the business of a medical professional because you want to help people. Number two, it's going to help you too, because it can be an extra profit center in your office.
Correct.
Number three, the patients will get better, and they will have results, not get better. They will have results, and they'll come in and they'll tell you. And then you just remind them that, if it's helping you, just let other people know. But that's what most doctors do anyway. They say, if I'm able to help you, let your friends know and your family know,
Right.
It's just like a restaurant or a movie, if you like it, you refer it. If you don't like it, you keep your mouth shut. So, so that's basically the way I would talk to a medical professional. You could also use the words, it's a great exit strategy. Okay, so if they're getting ready to retire and they want to do another way to, and it's an exit strategy that they can implement in their office and keep on going once they retire. And just keep it going from there. If you start it when you're in practice, then you have a base of people, and then you can keep growing from there.